Hello, and welcome to this presentation on caring for yourself while caring for others during the pandemic. This presentation was developed by the Institute for Disaster Mental Health at the State University of New York at New Paltz. I'm Karla Vermeulen, the Deputy Director of the IDMH, and I'll be leading you through this brief training on self-care and stress inoculation and other tools for managing stress while we're all in this very difficult time. Here's what we'll be covering in this presentation. We'll begin with an overview of typical stress reactions, so you understand why people are feeling the way they are. Then we'll look at some more outbreak-specific stressors that are definitely increasing challenges for people going through this difficult time. We'll talk about self-care practices that you can use to handle your own stress and hopefully get beyond just paying lip service to the need for self-care. And finally, we'll talk about stress inoculation, which is a very useful tool you can use to basically break down stressors into more manageable chunks and figure out how to tackle them. First, an overview of stress reactions. Now, this presentation is going to focus primarily on stress rather than trauma, but it's important to recognize that stress that maybe under normal circumstances we might be able to handle can quickly kind of merge into a state of crisis, which can then become full-blown trauma. That's a little bit different than going through something like a disaster or a sexual assault or a serious accident or illness or something like that, where you have an individual event that's basically leading directly to a trauma reaction. But instead, I think under the current circumstances, we want to recognize how quickly stress can escalate into a more serious reaction. And that's why it's even more important to tackle that stress and try and deal with it so it doesn't escalate in this way. It also can be useful to think about the different forms of stress that we might need to be dealing with. So acute stress is really what we evolved to be able to handle. That is some kind of specific new threat or challenge that activates our fight or flight system. Our sympathetic nervous system gets aroused. We do what we need to do to handle that threat, and then we go back to our baseline level of functioning. That's okay. I mean, it's difficult for sure, but that is kind of what we are equipped to deal with most effectively. It can be harder to deal with chronic stress. This is the stuff that just kind of forms the background of our lives these days. All the stuff that in some cases we're not even aware of it because it's just daily life. But that can be more challenging because it really takes a toll over time. If you're dealing with a high level of chronic stress, there's no way to get beyond it or recover from it. That does become your baseline level of functioning. And that's really not what we were evolved to deal with. And then, of course, traumatic stress is the most extreme kind. That is, like I said before, a disaster or some very awful, challenging event, which really overwhelms our ability to cope. And that can lead to something like post-traumatic stress disorder or other serious reactions. Let's also recognize that not all stress is bad. We really need to have some level of stress in our lives to keep us challenged, to keep us growing, to keep us motivated. If we didn't have that, there's kind of no reason to keep functioning or to keep trying in life. However, it's very easy for things to move from that kind of happy middle ground, which is sometimes referred to as eustress or positive stress, into too much stress or distress. A few points to keep in mind about these stress and trauma reactions. First, these are understandable reactions. We're experiencing them because we're going through something difficult or challenging or threatening or upsetting. So it makes sense that we have these troubling reactions. They are not signs of pathology. However, they're not pleasant and they're difficult and they do take a toll on us. So we want to do everything that we can to manage or contain or reduce these reactions while not treating them as a sign of disorder. These reactions can be immediate. Something happens, we immediately recognize our stress level is escalating, or sometimes they can be delayed. That's especially the case with that more kind of chronic stress where it's not that one particular thing has activated the fight or flight response. It's just that cumulative buildup of problems and difficulties that sometimes we're just not even aware of. We almost take it for granted that that's how we're supposed to feel. These reactions tend to change over time, especially when it is in response to a more acute stressor. So generally, we have a stress reaction and then it improves and we start to feel better over time. So that's good, but again, more difficult when we're dealing with chronic stressors. And then we always want to recognize it's not just emotions, but people can experience these reactions across multiple realms. Some of those emotional reactions can be thought of as more internalizing. So feelings like anxiety, depression, feeling vulnerable. Others can be more externalizing or outwardly visible. So things like being very angry or irritable, lashing out at people, being very tearful. Some people will kind of go back and forth between those two different types, or some tend more towards one or the other. Stress reactions also can take a physical form, like all of these symptoms. We probably all have our own particular way that we experience stress physically. It might be a clenched jaw or a headache or a tight neck or something like that. So being conscious that that is a stress reaction can be helpful. Then stress also impacts our behaviors in different ways. Some people want to get away from it. They want to withdraw socially. They don't want to see anyone. They want to avoid the problem. They just want us to escape from it, essentially. Others might be more needy. They want to have somebody to talk to. They want to express what they're going through. And then certainly one thing to watch out for is self-medicating with alcohol or drugs. Basically, those are ways of just trying to numb or blunt the stress that we're going through, but that can become problematic if it's overly relied on. Stress also impacts our cognitions, the way that we think, the way our brain functions. When we're feeling stressed, we're usually not thinking our most clearly. We might ruminate or just not be able to think about anything but the stressful situation, be very preoccupied with it. And often people will describe just feeling like they can't concentrate, they can't remember anything, they can't focus on anything. And it's just because their brains are just occupied trying to deal with the stressful thing that they've been through. And then sometimes stress, especially if it's coming from a more traumatic kind of experience, can have a major impact on people's spirituality. Sometimes people find an increase in faith after they've been through something very difficult. They say, it was God's will, or God has a plan for this, or something like that. But for a lot of people, there might be a loss of faith, or at least some diminishment of it, especially if it's something where people are saying, how could God have let this happen? So that can be very stressful in itself, if normally turning to faith would have been a source of comfort, and now they can't even do that. And finally, we have shame and guilt. These are more likely to occur in response to a traumatic kind of stressor rather than the more mundane or chronic kinds of stress, but they're so powerful that we really want to be on the lookout for them because they can be very harmful for people, and often they're based on really inaccurate or distorted perceptions. So sometimes just by correcting those distortions, that might help to relieve some of that shame or guilt for people. So essentially, shame is the sense that one is just wrong, one is flawed, one is lacking in some essential quality. And so, of course, that's an extremely powerful feeling to be going through. Guilt is generally thought of more as a sense that one did something wrong or one didn't do something that one should have. But it also can be very strong, and it can take these different kinds of forms. So feeling like maybe if you had been present, a certain event wouldn't have happened, or you would have been able to protect your children or something like that. Certainly survivor guilt, if you have a situation that other people haven't survived and you did, lots of questioning about why that is. And then performance guilt. That can happen to anyone, but especially for anyone who's in one of the helping professions or responder professions, there's always that feeling that you could have done more. And I mean, sure, we always can, in hindsight, identify something we could have done differently, but sometimes it can help people just to, encourage them to recognize what they actually did do or how maybe distorted their expectations of what they might have done actually are. So all of those stress reactions I was just talking about could occur in response to any kind of stressful or threatening situation. Now let's look at some of the particular factors related to the current pandemic and how those compound our stress in some very dramatic ways. Largely, these ways relate to the uncertainty and the unfamiliarity of this experience. This is very different than what pretty much any of us have been through before, and so we're having to figure out how to deal with it as we go along, and that really places a lot of demands on us. So some particular factors, we are looking at an invisible threat. You don't know if you've been exposed. You don't know if you're exposing other people. And that, frankly, is just creepy. It's disturbing to think that we might have taken something into our bodies that's going to harm us and not be able to know that. So that's problematic for sure. And that's similar to any kind of infectious disease. Then The impact is unpredictable. We know things are bad, we know things are likely to get worse, but we don't know how much worse. So we can't prepare for that mentally or practically. So there's that kind of uncertainty as well, which is highly stressful. Then we're looking at this social distancing, which is something few of us have experienced before. And that is creating all sorts of stress. And it's especially unfortunate because we know the best thing for people is seeking out social support when they are under difficult circumstances. And that's what we're exactly not allowed to do right now, at least in person. So that's particularly difficult. And then there's just all of the changing information situation. We're learning new details about the virus itself, new details about the practices and social policies and economic impact. And we are also, unfortunately, often getting conflicting information in official reports. So that all really adds up to just a giant, difficult situation that we're all just struggling to deal with. As a result, we're constantly needing to adapt to each of these changes and all of this new and unsettling information. And that means that each time we get a new piece of disturbing news, it kind of cranks up or ratchets up the baseline stress that we're dealing with. So even if you think about something maybe, hearing something very upsetting and having a real burst of anxiety and then coming back to your stress baseline that's become your new normal, that is higher than it was previously. So we're all dealing with this kind of ratcheting up, and means that we're now just constantly functioning at a level of stress that's much higher than we normally would and much higher than what's healthy or appropriate for us. Now, the specific concerns or stressors people are dealing with are going to be different for each individual just based on your circumstances, your resources, your personality characteristics, all of those kinds of things. But the next few slides will cover just some of the main issues that are probably troubling most people to some greater or lesser degree. First of all, obviously, there's fears about the virus itself, fears about getting sick, and fears about our loved ones getting sick. And this one is so unusual in that there certainly are known cases where people have been infected but asymptomatic and unfortunately have exposed other people to it. So there's that kind of guilt around that factor as well, which is really unusual. Then for anyone who is responsible for taking care of dependents, whether that's children, older parents, even pets, whoever it might be, there's going to be that concern as well about how are you going to continue to provide that caregiving if you get sick? Will the people you normally take care of be able to take care of you appropriately if you are incapacitated? And then certainly concerned as well about if they get sick, will you be able to properly care for them while you're also trying to hold down all of the other roles that you are responsible for? And then obviously now there's concern about just limited access to ventilators and other needed medical equipment and supplies and hospital beds and all of that. So that's very worrying for everybody, not surprisingly. There are also a lot of very understandable practical concerns that we're all grappling with while we adapt to not being able to just perform the functions or get the stuff we're accustomed to being able to get. So I don't think there's ever been as much attention paid to toilet paper in the history of the world as there has been during this period. But that's a legitimate concern, that and access to other groceries, also things like medications, prescriptions, other equipment that you rely on, even if it's not related to COVID-19, are you going to be able to get access to that while this is going on? Definitely a huge concern about the impact on children being out of school and longer term or mid-range term consequences for their education while parents are doing their best to keep up with homeschooling, but certainly not able to do that as well as teachers and schools are able to. For many people, there's absolutely major concern about their income, about their jobs. Many people have lost their jobs. People are losing businesses. So that's obviously, a huge issue for a lot of people. And then there are just going to be other individual ones, which I can't begin to try and describe, but you're all thinking of your own personal practical concerns right now, I'm sure. Then there's a range of social concerns a lot of people are experiencing. So how is this going to impact community in general? As I'm recording this, there's largely a sense of kind of coming together and helping each other, supporting each other, but we don't know if that's going to last, if people are going to start getting competitive or turning against each other. This is all going on during the run-up to a presidential election, and so political differences that were already in existence are certainly getting exacerbated by all of this. This idea of hoarding and creating competition for resources, what are the longer term social consequences of that going to be as we adjust to each other's behavior? And as I said before, the need to stay connected is so essential, but how can we do that? Thankfully, we're doing this in a time when technology makes that more possible than ever, but it's still not the same as actually being present with people. And then just thinking about so many people are missing irreplaceable experiences, graduations, family parties, all of that kind of stuff. How are we going to recognize those losses and mourn them and really recognize the significance of them? Maybe come up with some alternative rituals or ways of marking these occasions. I know virtual happy hours and virtual birthday parties have become a thing. But again, how, we need to recognize the impact of not being able to have those real experiences, and we need to give ourselves permission to recognize how significant that really is. I mentioned this before, but these economic concerns really can't be underestimated. And that includes both short-term concerns like, how am I going to keep feeding my family and paying the rent while this is going on until I can start working again? And then longer-term ones, am I going to lose the business that I've spent my life building up? Or for people who are maybe just finishing college right now and launching their careers, how is this going to impact the trajectory that they get started on? And will they ever be able to catch up to peers who started their careers in more fortunate or prosperous times? Then in our final category of outbreak-specific stressors, for people who are fortunate enough to keep working, how are you going to balance work and life demands in a way that's going to keep you sane and healthy? This is especially problematic, of course, for people who are frontline workers, essential workers who are still out there in the world, running our hospitals or delivering our mail or keeping our grocery stores stocked. For those people, of course, there's going to be a lot of concern about meeting their professional responsibilities while also not only staying safe, but managing their anxiety about staying safe and their family's anxiety as well. So that's a real challenge for this group. For those who are working from home, maybe a little less in terms of the intensity of the stress, but it can still be stressful, especially if you're trying to deal with young children while you're trying to keep up your work responsibilities. And that includes those things around boundaries. If your dining room table is now your office, how do you know when it's time to shut the computer down and stop for the evening? So that can be a bit difficult to adjust to. And then for supervisors, trying to make sure that your teams are functioning okay, how do you balance looking out for their well-being and being, tolerant of the challenging circumstances everyone's working in, while also maintaining the standards you need to for productivity and for keeping the business running? Clearly, we're all dealing with a wide variety of stressors, and some of them are really, really intense, far beyond what we're used to dealing with. So how do we handle that so that we can keep functioning throughout this, without knowing how long this is going to last? It is so important that we actually pay attention to self-care. This often gets a lot of lip service. We say we need to do it. We all joke we need to be better at it. We really all need to get better at it right now. Because if we don't get better at it right now, quite simply, we are not going to be able to continue functioning, and we're certainly not going to be able to keep taking care of the people who are relying on us to get through this. So that's why we describe this as a self-care imperative. It's not a luxury. It's not a sign of weakness. It's not soft. It's not fluffy. Practicing self-care is essential. It's your responsibility to do it so that you can continue on in your professional role, all of your various personal roles, and so that we can get through to the end of this disaster. Now, some people who are watching this presentation might not think of yourselves as working in traditional helping professions, which are usually things like social work or counseling or spiritual care providers or teachers. Your field might not have anything to do with that, but I will still argue that if you're in a position that impacts other people in any way, you are called on to care for those people. And so some of these findings about both the benefits and costs of caring for others will apply to you. So this slide is talking about this idea of the compassion stress continuum, which is this line between when we are feeling positive about the work we're doing and getting satisfaction from it, or when we are not getting that satisfaction and maybe we're just burned out, we've been doing it too long, and we're feeling that sense of fatigue. So even if the word compassion doesn't speak to you, think of this as helping satisfaction and helping fatigue, or professional response satisfaction and professional response fatigue. It still applies, just adapt it to whatever works for you personally. Obviously, we all want to be on the satisfaction side of the continuum, and that can occur, I think it's important to note, even if you are stressed by the work that you're doing, even if you're pushing yourself incredibly hard, even if it feels difficult and challenging. That's kind of that eustress side of things that I talked about earlier. But this is where we want to be, where we're feeling like we are actually accomplishing something. We're having that feeling of purpose, that we're able to contribute to the effort, that we are competent. So that's what we all want to do, and that's not completely separate from feeling like we are being pushed. If you want to kind of get a check on how you are doing and quantify that a little bit, this link here, it's the ProQual, the Professional Quality of Life instrument, which is a nice way of just kind of checking off how you're feeling about your work, and it can be helpful. So that's a nice tool to use if you just want a little like check in on how you are functioning. On the other side of that spectrum, we have compassion fatigue. And this is pretty specific to those helping professions, or again, anyone who is working to try and help other people or animals or any other living creature. This basically is usually thought of as what happens when you have just overextended yourself. You've given too much of yourself to the point where you just don't have anything left to give, and you're not able to recharge and get back to kind of a healthier spot on that satisfaction continuum. And this can be especially difficult for caregivers, because those of us who think of ourselves as being, wanting to help others, that's very much a part of our identity. And so when we reach the point where we just can't do that any longer, it feels like a real loss of a part of ourselves. So this is something we certainly want to be trying to avoid. Then the equivalent that someone from any profession can reach is just this idea of general burnout. And that is where you've just been doing too much of whatever you're doing. You're exhausted. You don't get as much pleasure out of it. You've lost that sense of satisfaction in your accomplishments, and you just don't want to go. You don't want to go to work. Now, for many of us these days, we don't want to get out of bed and go to the dining room table and do our work. And that is certainly associated just with a high workload or stressful workload, and also when we don't feel like we're getting supported, or we don't feel like we're being appreciated for the work that we are doing. In order to avoid developing those negative outcomes like compassion fatigue or burnout, this is where it's essential to do that actual practice of self-care. Figure out what works for you and actually do it. So why are we all so bad at that? I'm sure there are some exceptions out there listening to this, but many of us just know we need to do it better, and we just don't put the time into it. Well, these are some of the common barriers to practicing self-care. Sometimes it's just a lack of experience or training, so people just don't recognize the need for it. They've got the confidence of being early in a career and don't recognize that it's going to take a toll, and that they are going to burn out if they don't take care of themselves. And for a lot of people, there's this idea of this myth of professional immunity. I'm the one who takes care of people. I don't need to do anything for myself. I exist to serve others. I'm okay. My needs don't need to be met. So that is not helpful. Then a lot of negative self-talk. I'll come back to that in a little bit, but that's kind of that story that we tell ourselves about what's going on. We might have this perception that other people are okay and meeting the challenges that we're struggling with. Chances are that's a misperception, and they're struggling as well. But that kind of, voice telling yourself everyone else is okay, I must be weak, or, I can't do this, or they'll think that I'm soft. And again, the last point, the stigma. I can't ask for help. I can't acknowledge that I'm struggling, because then they'll think I'm incompetent. I won't get promoted. They'll fire me. And all of those are generally not accurate perceptions, and they're definitely harmful perceptions. So let's talk about some practices that you can work on to actually improve your self-care. First, a lot of what's often recommended are these more emotion or behavior-based strategies. So that could be things that are more emotional, like mindfulness, meditation. That can be a great way just to kind of recenter yourself, to calm yourself down. Paying attention to your breathing is often a good way of catching when you're starting to get very stressed out or anxious. For a lot of people, this is really helpful. It often is a little hard to get started. You have to start practicing it a little bit before you feel the benefits. But if you're able to stick with that, these are great. They're also wonderful because you don't need any tools, you don't need any equipment. You can do them in a moment. You can do them while you're hiding from your kids in the bathroom for a minute. So these are really great things if you are able to make them work for you. Then for other people, it might be more behavior based. So especially things like exercise, whether that's yoga or going for a run or a bike ride. Unfortunately, I think a lot of people who normally get stress relief this way are not able to do that, especially if they're used to being able to go out to a gym that is closed for the time being, or bike trails are closed or anything like that. So that's hard. I know a lot of people are, taking Zumba classes in their kitchens and that kind of thing. But these obviously can be very healthy because they're good for your body. And then that carries over to being good for your mind and your stress level. So all good stuff if they work for you, but sometimes these are not sufficient to deal with the kinds of stressors you're dealing with at a particular time. A different approach to self-care and stress management that I don't think gets nearly enough recognition or attention is taking a more cognitively focused approach, using some of these different kinds of strategies. So I talked a minute ago about negative self-talk and misperceptions that might prevent us from seeking help when we need it or recognizing the need for self-care. So we can reverse those by changing that script, revising that little voice in our head so that it's not saying you can't seek out help or they'll think you're weak, but instead is saying you need to seek out help so that you can continue to do the work and that will be recognized and rewarded. So just kind of recalibrating our thoughts is helpful. And then what I'm going to spend the next bit of time talking about is this practice of stress inoculation, which is a really good way to break things down and try and make a big source of stress much more manageable. The name stress inoculation borrows from the medical world. It's that idea of intentionally injecting a small controlled dose of a stressor in a controlled environment in order to then activate the mental equivalent of the immune system so that we're preparing in advance for what we're going to encounter. And the goal with it is not to get rid of the stress that we're ultimately going to face, but to manage our stress about it. So this is especially useful if you know you're going to be called on to try and do something that might feel particularly challenging or even threatening. It's a great way to prepare for that. And it really starts with just acknowledging that you are going to feel stress about this. You can't make that not be the reality, but there are things that you can do about it. So you can also manage your expectations so that what you're going in is not feeling like you have to be perfect or everything is going to be a catastrophe. It can help you think through in advance what you might encounter and what you might feel as you encounter that. And most importantly, it helps you prepare mentally for that. So essentially what you're going to be doing is going into that stressful situation with a mental plan in place. So rather than trying to process it and respond to it on the fly, instead you're basically activating the plan that you have calculated or formed in advance. These are the main components of stress inoculation, especially the first three. Those are going to be what most people are going to focus on. You might be able to use the fourth if you're a supervisor or a manager, and you might be able to change things at the more systemic level to reduce some stressors for your organization. But for most people, we're going to focus on first identifying stressors, appraising them, and then figuring out what kind of coping strategy is going to be most effective for dealing with them, whether that is problem-focused or emotion-focused. This first step of identifying potential stressors focuses on really thinking through as clearly as possible what you might encounter in this situation that is causing you anxiety or stress. And that gives you the chance to identify the particular issues that you're going to want to be preparing for, doing that kind of mental dress rehearsal so that you're ready for them if and when they do happen. So those stressors could be things like if it's a physical experience, we often use this in training people to deploy to disasters where they might be exposed to difficult sights or sounds or smells. under any circumstances, you might be exposed to people who are very upset or very emotional or very angry. It might just be your own general sense of not feeling up to the job. Or a lot of what we're looking at now, of course, is just that kind of uncertainty about the future. So you're not going to be able to predict every single thing that you want to prepare for, but I think often it works just to kind of follow your gut. Like think about an upcoming experience that is causing you some anxiety, and you can pretty easily focus in on what aspect of it is causing you that anxiety. So then that's what you're going to want to prepare for. So for example, a lot of us have been learning to use technology to deliver presentations or to hold meetings and things like that, and feeling a little anxious about that. What are you actually anxious about there? Is it the technology failing? Is it looking foolish? Is it not seeming prepared? So just, tune into what is bothering you and then focus on that as you move through those next stages of the process. In the second phase of stress inoculation, you're going to take those stressors that you've just identified and you're going to appraise them. You're basically going to tap into the subjective evaluation that you're already making unconsciously about whether this is something that you can manage or whether it isn't. Do you feel innately that you have the ability to meet the needs of the situation that you are about to be entering into? So this goes back to that idea of self-talk. Is that little voice in our heads convincing us that this situation is a threat or that it's a challenge? Pretty sure you can guess which is the one that we're wanting to be going into it thinking of as, but often we do immediately perceive these things as a threat, which is why we're anxious about them in the first place. So that's problematic because when we are seeing a situation as a threat, we tend to clutch. Basically, whatever coping ability we have can easily get overwhelmed, and then we get into that kind of anxiety spiral where we're feeling more and more anxious about it rather than breaking it down and figuring out how to deal with the emotions we're feeling about it. We also tend to narrow our thinking. We're not as creative. We can't go beyond what maybe the initial approach that we've fixated on is. We just kind of, narrow down and don't look for other resources. We don't tap into potential sources of support. We can't just figure out how to tackle this situation when we're viewing it as a threat. So the little voice in your head is now saying things like, you can't do it, it's awful, I can't manage this. And unfortunately, sometimes that becomes kind of a self-fulfilling prophecy, because if that's what you're telling yourself, then of course you're not going to be able to rise to the occasion most likely. So instead, what we want to do is use some cognitive reappraisal and just literally talk ourselves out of that threat perception and try and talk ourselves into viewing it as a challenge. Because if we're able to view it as a challenge, it pushes us back into that eustress, that positive stress position where, yeah, it's still difficult, but we're rising to the occasion. We are thinking we can take it on. We're viewing it as something that we're going to go into, and we're going to do everything we can to perform as well as we possibly can, while recognizing that's not likely to be perfect. So in this situation, if you're in this mindset, you're just much more likely to be thinking creatively, calling on different kinds of coping skills that maybe you would shut off when you were in the threat position, breaking it down into manageable pieces. This is so important. Getting it from being this kind of brick wall standing in front of you that you can't see beyond to boiling it down or breaking it down, knocking it down into, I always use this analogy, from a solid brick wall into piles of bricks. So you still have to tackle each of those piles of bricks and figure out how to deal with them, but at least you can do that one at a time. You can prioritize and you can call on other resources, get additional training you need, bring in support from a supervisor or someone with specialized experience. Whatever it is, you're just going to be much more likely to be able to figure out how to deal with the situation if you are going into it thinking of it as a challenge. Okay, now that you've talked yourself into viewing the situation as a challenge rather than a threat, the final stage of this appraisal process is to think about whether each element of the stress is under your control or not under your control. So can you change the source of the stress or not? And based on that, how are you going to cope with what you are confronting? First, if you can determine that some of the things that are stressing you really are indeed under your control, you're going to want to take a problem-focused coping strategy to figure out what you can actually do about those aspects. Because if you can take some of these actions, including further breaking it down, brainstorming, developing new skills that you need, you can not only keep breaking down the bricks into smaller and smaller piles, but you can actually get rid of some of those piles entirely. So to return to our admittedly pretty low stakes example of feeling stressed about leading your first WebEx meeting or something like that, in this area, if what you're concerned about is that you don't know how to use the technology, learn to use the technology. Seek out training in that is going to let you get rid of that particular aspect of what you're concerned about. So if you can control it, implement these problem-focused strategies and actually take away parts of the problem that you can. On the other hand, if you recognize that what is causing your stress is genuinely not under your control, then you're better off using emotion-focused strategies. So these are basically ways of acknowledging, once again, that this is a stressful situation. We're not pretending that it's not. We're also recognizing that, unfortunately, we don't have the ability to change what's stressful about it. However, what we can do is have some practices and some plans for how we're going to deal with that. So going back to our same example, if one of the things you're anxious about is that the internet is going to go down while you are leading your meeting and it's all going to get disrupted, you probably legitimately can't do a whole lot about that. But what you can do is figure out, what is your plan going to be if that happens? How are you going to manage your own emotions around it? So this is where we go back to some of those mindfulness activities that we talked about before. So things like meditation and relaxation exercises. Also just helping yourself become more accepting of the fact that a lot of things are difficult to deal with right now. We're all coping with a lot of emotions that are maybe unfamiliar or a lot more intense than we've had to deal with in the past. So right now, under the pandemic, there are some things we can control, like our own behaviors around it, but there's a lot that we can't. And I think it's better to recognize that and then try and develop some skills for how we're going to cope with some of those emotions that we can't control, so that we're able to deal with them more effectively and feel less overwhelmed by them. So these are all good things to practice. Anchor management. I'm a big fan of distraction. That could be, get your mind off of it. Stop watching the news and instead watch your favorite sitcom on Netflix, or listen to your favorite piece of music, or watch puppy videos, or whatever you need to do. That's all good stuff to do. It's necessary. And again, it doesn't mean you're avoiding the situation. It just means you're taking care of yourself by giving yourself a break from it. Then the final step in stress inoculation, which, as I said, is mostly aimed at supervisors or people who are able to make more structural or systematic changes, is figure out if there's anything you can do at that organizational level. And that's great if you're able to do that, because if you can implement some new change or policy, that can have a trickle-down effect that benefits everyone who it impacts. So anyone who has the ability to make this kind of change, I would definitely encourage you to try to seek out those opportunities and figure out what you can do. And part of that includes a kind of stress inoculation for your staff members. If you are preparing them to take on some new task or role, helping them go through this process and understand what they might encounter so that they feel as prepared as possible. So those are all some useful tips that you can use in just trying to break it down. It might seem like an odd thing to describe this as self-care, but I really think it is, because if you can use these techniques to reduce your stress, then that frees up some of your emotional energy to confront all of the other challenges that you're dealing with right now. Finally, here is a visual showing stress inoculation in the form of a flowchart. Your first steps are going to be to identify and appraise each stressor and figure out, are you viewing it unconsciously as a threat or as a challenge? If you are thinking of it as a threat, your first step is going to be to reframe it as a challenge. So you're going to change that script, try and talk yourself into viewing it differently, remind yourself of the abilities that you do have and the experiences you've had, reach out for some sources of support, and hopefully that will allow you to reframe it as a challenge. Once you've done that, you then want to start thinking about what aspects of this are things that you can control or change and what are outside of your control. For those that you could control or change, you're going to want to use some problem-focused coping strategies, like keep breaking it down into more and more manageable parts, brainstorm, reach out to get the additional skills you need. And here your goal really is to keep changing and addressing the stressor to the point where you make it go away entirely, or you feel entirely prepared to deal with it, in which case the challenge is still there, but you're not viewing it as a stress source. On the other hand, we need to recognize there are many things we can't control, especially under the current situation. So in those cases, we want to draw on our emotion-focused coping strategies like relaxation, like helping ourselves accept the emotions that we're going through, dealing with anger and other strong emotions, and distracting ourselves, giving ourselves a mental break that we need just to be able to get through these challenging times. And that concludes this presentation on self-care, stress management, and stress inoculation. I'm Karla Vermeulen, Deputy Director of the Institute for Disaster Mental Health at SUNY New Paltz. We're an organization that provides a lot of trainings and resources for people who are involved in various aspects of disaster response, which frankly I think includes everybody at the moment, including all of you. We hope you found this helpful. Please don't hesitate to reach out to us if we can help you in any way, provide additional trainings. We have some resources on our website, and we hope everyone stays well through this extremely difficult time. Please do take care of yourselves. Thanks.